Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top Early Learning Centers here in Wichita, Kansas. Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top Early Learning Centers here in Kansas. And I am also the chair of the Early Childhood Recommendations Panel. I'd like to thank you all for watching. If you are watching the live stream and for all of our panel members, thank you for taking time out of your busy week to be able to be here to help us serve the children and families of Kansas. This is a remote meeting, and so today's meeting materials are posted on the panel meetings website at the Children's Cabinet website, which is kschildrenscabinet.org. Panel members, we ask you to clearly identify yourselves when you begin to speak. We also suggest, but it is not required, that you raise your hands so that we know if you would like to share out, just because we may end up missing you otherwise, and we don't want to miss anything that anyone has to say. So for today's agenda, we'll have our approval of the October agenda, approval of our September meeting minutes, which Hannah sent out earlier this week. We'll have any comments from the Kansas Open Forum, an update on the preschool development grant, a Chamber Blue presentation. We'll have a break for 10 minutes, and then we'll break out into work groups. And so this is our first meeting this year. We'll have our work groups, and we'll have an opportunity to kind of share and talk more in our groups. Our work groups are going to report out to us and give us any updates. We'll have some bright spots and give you opportunities to share the wonderful things that are happening in your communities or with your programs. We'll give an upcoming meeting schedule, and then our meeting will be adjourned. So we will start by approving the October agenda. Panel members, please clearly identify yourselves when you begin speaking, when you make your first and second motions. And so first, Hannah did send out the October agenda. There has been an update to the October agenda. And so with the modification, our presenter from the Lawrence Chamber had to cancel. And so there has been additional time that's added to work group sessions in lieu of a second presentation. And so with that modification, do I have a motion to approve the October agenda?
This is Aldana Chestnut. I can move to approve the agenda.
Perfect. May I have a second?
This is Kim Kennedy, and I would move to second.
Perfect. All those in favor say aye, or raise your hands.
Aye.
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 All those opposed, same sign. Okay, the September minutes were sent out earlier this week. Do we have any updates or modifications, recommended modifications to the September minutes?
I did not receive any.
You did not receive any minutes or any changes? Okay, perfect. Okay, great. And so may I have a motion to approve the September minutes?
Hi, Cornelia. This is Jennifer. Sorry, go ahead.
Tara Taylor, I motion to approve.
May I have a second?
This is Jennifer Francois. I second.
Perfect. All those in favor, raise your hands. And opposed, same sign. It looks like everybody's there. Perfect. Perfect. Okay, great. So we did not have any presentations today or anyone that wanted to come and speak, but if you are watching on our live stream, please know that we do have a Kansas Open Forum where we encourage people to share comments or questions, any concerns or whatnot, with the panel. And so Kansans are encouraged to email Hannah White at hwhite@ksde.org by 5 o'clock on November 17th to be able to share with the panel on the following day. And so please submit your comments, questions, or any updates that you have, again, by November the 17th. For our first present, pardon?
We did not receive any open forum comments for the last month.
Perfect, thank you. So the first presenter is going to be our very own Miss Melissa. And so Melissa's going to give us an update on the preschool development grant.
Thank you, Cornelia. I appreciate the invitation to come join the panel this morning. I know there's knowledge out there that the Administration for Children and Families opened up a grant renewal opportunity for the Preschool Development Grant Birth to 5 program. And I just wanted to give a little bit of an update on where we stand with things for Kansas. As most of you are well aware, we first had a 1-year planning grant in 2019 that allowed us to conduct the statewide needs assessment and convert the findings into our 5-year strategic plan for early childhood. We used that work to apply for the 3-year renewal that we are currently operating under. We are in year 3 of that 3-year grant, and about a month ago, the feds opened up a funding opportunity for a 1-year renewal for PDG states to apply for. It is a fairly competitive grant opportunity because it is the eligible states are all of us who are currently operating with preschool development grants funds. And then there are a handful of states, like 2 or 3 states, that have never gotten preschool development grant. So we are all competing in the same pool for a finite amount of money. In comparison to other preschool development grant offerings, the total amount they have to award is not all that much. It's I think they have $36 million total. The grant opportunity says that the minimum they will award is $500,000. The maximum is $4 million. They anticipate offering 10 awards. There are currently 23 PDG states plus the 2 or 3 others that are also eligible. So a lot of competition for not a huge amount of money, but certainly it would be welcome, and we immediately agreed that the state directors team met and agreed that we wanted to go ahead and compete for an award. This is a planning grant, so it's again an opportunity to take stock of the system, to renew the needs assessment. That is one of the mandatory activities, to refresh the needs assessment. I think we've been doing that annually, doing many updates on the needs assessment, but this would be a more in-depth look, and I think, you know, coming out of the pandemic, probably wise to revisit where we are. It is also necessary to update the strategic plan with these funds. So those are the first 2 required activities. We also have the same categories that Preschool Development Grant has had throughout. We want to maximize parent and family engagement, support birth through 5 workforce, and improve dissemination of best practices and things like that, and then support for program quality improvement. But the emphasis from the feds has been placed on the workforce piece, because they recognize nationwide there is a childcare crisis, and they are really seeking to boost the kinds of strategies that can be brought to bear. So they are looking for plans that balance out across the various activity categories, but certainly they are offering more points for applications in the workforce section. So we see that emphasis as important. There are certain internal requirements to this application that we are working to comply with in terms of how we balance out performance evaluation versus the activities themselves. So our grant writing team has been hard at work on a sprint timeline, because it was announced in late September. The grant application is due no later than November 7th. And then the timeline to respond with awards is prior to the end of the year, anticipating a December 30th style announcement, because certain actions have to happen in Congress and to authorize things and whatnot. So we just wanted to make sure that there was knowledge that we are definitely applying, and understanding that this is a planning grant. So you won't see a continuation of the sub-grants, because those it's a combination of the award not being large enough and the activities being focused on a planning year as opposed to implementation. So I'm happy to try and field any questions if you all have any at this time.
Kelly?
Hi, this is Kelly David of Melissa. I'm so excited that Kansas is embracing this opportunity and going after what's, a pretty competitive grant opportunity, but really important. I think one of the questions I have is how you see the recommendations panel maybe supporting the planning year activities if awarded. What opportunities are there for us as a group to support the work that's laid out in the grant, inform, take on pieces, and wrestle with it, just kind of overall in the spirit of collaboration and support on this system opportunity?
For sure. Yeah, no, there absolutely will be a role for the panel. I would assume systems improvement team. There are several governance groups that we will be working into the game plan. I have not yet seen the first draft of the grant application, so I can't speak to specifics. I know I've been in conceptual conversations, but particularly given the work of the strategic plan update, I definitely know this group will be at the table. I would also point to the plan the governor released yesterday, her second term priorities, should she prevail in the election, and we'll wait and see what happens. Stay away from political conversations here, but Governor Kelly has announced second term priorities that involve elevating early childhood to a governor's cabinet level position, creating a secretary of early childhood development position in the cabinet, and then looking to reorganize. So I would stay tuned for a role in the process of organizing such a shift. And I would also say that regardless of election outcome, I do think the emphasis and prioritization on early childhood is important. I think it's a nonpartisan issue, and I would hope that any administration coming in would seek to elevate the concerns that we all share for early childhood to a prominent position in their administration. So stay tuned.
Any other questions or comments from Melissa? No. Well, Melissa, thank you for the update. I'm very excited that Kansas is, that we're working on an update. I think that especially, as you said, with the pandemic, it's changed a lot in terms of the landscape of where we are. And so, we know that we've had people across the U.S. that have looked at us in terms of what we've done with our grant and the stuff that we're doing on our collaboration, et cetera. And so that means that I think that we are going to submit a pretty amazing application in terms of the work that we've done so far. And we'll be crossing fingers and toes that we get refunded. So thank you for that.
Yep. Thank you.
Next on the agenda, we have a presentation by Doug Martins, and he is from Blue Cross Blue Shield. And so he's going to talk a little bit about Chamber Blue and a possible opportunity that we may want to consider in terms of being able to improve benefits offered, to the people that work with us in our programs.
Perfect. Thank you very much. It's a pleasure to be part of your meeting this morning. I do appreciate the opportunity to talk to you about the Chamber Blue of Kansas plan. I've got some slides here I'm going to go through, but hopefully I can leave about 10 minutes or so at the end to answer any questions that you might have. I know you've got a full agenda, so certainly want to stay on task, but certainly want to answer your questions as well. So with that, we'll just kind of dive in. The Chamber Blue Plan of Kansas has been put in place through the Chamber of Commerce Executive of Kansas. And they're the ones that reached out to us probably a couple of years ago about putting together an association health plan. And so we've been working on this for quite some time. Some of you may have heard our presentation already and may be familiar with some of the information I'm going to go through today. So if that's the case, I apologize. You're going to probably hear some things again, but we've been communicating out across the state to the Chamber of Commerce, getting them on board with the Chamber Blue of Kansas plan. So go ahead, if you would, Hannah, go to the next slide. This is just a quick agenda. So just going to touch on a few things here. I do want to let you know that this slide deck is one that we've been using across the state all year. So as we go through, I'll talk to you about a few things because we're getting so late here in 2022. There have been a few changes, so I'll certainly make note of those as we go through. So the next slide is just giving you kind of a flavor for the chambers that have committed to the Chamber Blue of Kansas plan. Like I said, back in April and May, we started approaching all of the chambers across the state to see if they would participate in the association health plan. And it was up to each chamber to decide whether they wanted to participate or not. This is not a complete list. There's been others that have been added to this list. But from my knowledge, most chambers across the state decided to participate in the Chamber Blue plan. So it's been very well received. Of course, the chambers, local chambers across the state have helped Blue Cross in communicating the benefits and the advantages of being part of the association health plan. So we certainly appreciate the partnership with all of the chambers across the state. So just real quick, you might ask yourself, okay, so what is an association health plan? A few years ago, there was legislation passed around association health plans. And so we've seen some of them crop up, but basically in a nutshell, it allows smaller companies, organizations to band together for the purpose of health insurance. And those association health plans are regulated by the Kansas Insurance Department and the Department of Labor. Essentially, how an association health plan works is, again, employers band together to purchase insurance. And the whole kind of idea behind insurance is the larger the pool, the risk is then spread across a much larger population. So you have some good risk in that pool that typically then will offset the bad risk. Whereas if you're a small employer across the state, depending on your size, your group's premiums may be dictated just based on the risk of your group. And so we've seen the premiums for those type of groups fluctuate over the years pretty significantly, depending on whether they've had high claims utilization or not. So part of the advantage of being in an association health plan is typically over time, the premiums are more stable in an association health plan. So again, more people, more options, and potentially lower cost. And I say potentially because you just never know who's going to be in that pool. And that, quite honestly, is something we're working through right now to determine who's going to be in that pool for 1/1 of 2023. So the value of your member businesses. So as maybe you're talking to your member business, maybe you are a business. Again, there's more buying power So in a lot of cases, you're going to be able to get more competitive rates, as I talked about before, because instead of, let's say, an employer of 20 employees, now you're part of a much larger pool, let's say of 2,000 employees. So you're spreading your risk amongst 2,000 versus just 20 individuals. And then more choices. The plan design, and I'll get into that here in just a little bit. There's 8 different plan designs that are being offered through the Chamber Blue. And so depending on the size of your group, you may have more choice as far as your plan design through the Chamber Blue plan versus on your own. I do want to point out to you that you'll see that initial rates based on employers who complete the August interest survey. So we asked that those employer groups across the state complete an interest survey, and that was done online. And that interest survey had to be provided to Blue Cross Blue Shield of Kansas by November the 18th. I'm sorry, September the 18th. And by completing that interest survey, that guaranteed those employers to go into the chamber plan effective 1/1 of 2023. If for some reason a business did not complete the interest survey, those businesses are not going to be allowed in for January 1 of 2023. And every subsequent calendar year, they would have an opportunity to come in. So some of you might have completed that interest survey, others may not. So I just wanted to make sure that you were aware of that. So long-term success and best practices. So this is where it kind of gets into a little bit of the Blue Cross and Blue Shield piece of it. So of course, Blue Cross and Blue Shield is the administrator of the Chamber Blue plan. So you've got the carrier expertise, the reputation. We are the largest carrier in the state of Kansas. We have the largest provider network. So, you know, we've been around for a long time and will continue to be around. There's stability in the rates. And again, just going back to the size of the pool, and what we see with our other association health plans and other associations is over time, rates are more stable in those AHPs. And then large group benefits are available to smaller employers. So what that simply means is today, if you have a small employer that has 50 or fewer full-time equivalent employees, those groups have to have a metallic level Affordable Care Act plan. And those plans are individually age rated. And quite honestly, some small employers don't like the fact that their plan is individually age rated. And by going into an association health plan, you're then actually viewed as a large employer, even though you may only have 20 employees. So large group benefits are available, even if you're a small employer. And your rates are what's called composite rates. So instead of individually age rating your group, the rates under the association health plan are composite. So all employees would have the same premium. If you wanted yourself and your children or yourself and your spouse, that premium would be the same across the whole Chamber Blue population. Again, largest provider network in the state of Kansas. Some of you may be aware of this, but we do have 99% of all the providers in our network. From a physician standpoint, 100% of the hospitals in the Blue Cross Blue Shield network, and we cover 1 in 3 Kansans. We also have a true nationwide network. So that's critical when you have maybe dependents that are away at college, maybe in a different state, or you know, maybe you're traveling in a different state and you need to seek services. We have 92% of the physicians in our network across the United States. So as long as you're seeking services from a Blue Cross and Blue Shield provider, doesn't matter which state you're in, you're going to receive the highest level of benefits. So not only from a percentage standpoint, but at the bottom there, you can see we have very, very significant provider discounts, and those provider discounts are not billable back to the members. So this slide right here, really I refer to as the power of blue, is the provider network as well as the discounts. A couple of other things that are being offered through the Chamber Blue plan, that these are also offered under our normal book of business as well, but you have our healthy options, which is available on our website. So, you know, there's a lot of health and wellness tools out there, disease management, case management, behavioral health is a big one right now. So we have a lot of information out on our website regarding healthy options. You'll see telehealth down at the bottom. We do use a company called American Well or Amwell for our telehealth services. It's a great convenience item, available 24/7, 365. And telehealth visits are covered just like any other primary care office visit. So just another convenience item for those that may reside maybe in a remote area, and maybe they have to drive to see their primary care physician or to an urgent care type facility. And then Blue Access allows members to access their personal information either on a computer, but we also have a Blue Cross Blue Shield app. So they can download that information and look at that information directly on their iPhone as well. This just gives you an idea as far as the sales support across the state. So we do have offices here listed, and we do have about 40 Kansas-based external representatives. One of the things that you'll see at the end of the slide is my contact information, but there should be a representative from Blue Cross Blue Shield assigned to every group, whether you're with Blue Cross today or a current enrolled business with Blue Cross. Everybody should have an assigned representative. If you have further questions, you can certainly work back through me, but also if you know who your representative is from Blue Cross, they would be a great person to reach out to as well. So either way, you can contact me. Hannah's got my contact information as well. So if you don't know who to contact, certainly work back through me, and I'll get you to the appropriate area. So this starts to get into kind of specific to the Chamber Blue plan. This is the website brochures and marketing tools. You'll see the link there to the actual Chamber Blue of Kansas website. I would encourage, if you have some time, go out there. There's a brochure out there. There's marketing material that really gets into what the 8 different benefit plans are. There's a kind of a screenshot here, but it's kind of hard to read. But that information is out on the Chamber Blue of Kansas website. I will tell you, for those groups that have completed the entrance survey, the rates have been provided to those particular groups. So the groups are aware of what the rates are for 1/1 of 2023. I do want to let everybody know one of the changes that was made from when we initially rolled this out to now is the rates that we have on the table so far for 1/1 2023 are not firm rates. One of the changes that was made was we are going to do a final assessment of those groups that truly want into the Chamber Blue of Kansas plan after November the 18th. So groups that want into the Chamber plan for a 1/1 2023 effective date have to submit their paperwork to Blue Cross and Blue Shield by the 18th of November. And then we hope by around 12/1, if not sooner, we will know what the final rates are going to be. Okay, so there was a little bit of confusion around that because initially we thought that the initial rates that came out were going to be firm rates. So a little bit of information here from the employer perspective. So one of the things that's really important is the employer group must be participating with their local chamber. Oh, sorry, the previous slide there was the second page of the benefits. Actually, Hannah, go back one, because there is something I want to mention. Is it the next one, maybe? There was one that I saw that flashed up on the screen. Maybe not. Maybe, oh, there's the, yeah. So I'm maybe going out of order. Sorry about that, Hannah. But on this one, I did want to mention to you that there are, again, 8 different benefit options. What you're looking at here is the second benefit options. Actually, I guess this is the options 1, 2, 3, and 4. And then you'll see when you look at that, maybe online or on the website, there'll be a 5, 6, 7, and 8. There is the opportunity to offer just one of the 8 plans. We do have combinations that we would allow as a high-low option. We do have what's called triple option plans. So you could offer a combination of 3 different plans, or we actually have quad options. So you could offer, for instance, you could offer options 1, 2, 3, and 4, as you see on the screen here, if you wanted to do that. So there's a lot of different choice, again, more choice being in a large group than you would have if you were a small employer group.
Would you like this one?
Yes, please. Thank you. So the first bullet point there again, the employer must be part of the local chamber plan. So a lot of chambers across the state are actually viewing this as a good thing as well, because they're seeing their membership enroll as well if the employer wants access to the Chamber Blue plan. So they're using that to grow their membership as well. Employers must have at least 2 W-2 employees or qualify, or if you qualify a sole employee with a legal business entity, S corporation, C corporation, LLC established would likely qualify. Again, as I'd mentioned before, employers must participate in the interest survey through August 2022 to guarantee entrance into the Chamber Blue of Kansas plan. Employers need to pay at least 25% of the low-cost plan option offered. So that's important to know. And then on all of our plans at Blue Cross, we do have participation requirements. And the standard is 70% participation of all eligible employees. And what we do is we take out from that calculation those employees that have group coverage elsewhere. So that's the calculation down there at the bottom. So the employees in your organization that are covered through a spouse, covered through Medicare, Medicaid, any type of group policy, those are subtracted, and then we need 70% of what's left within your group in order to participate in the plan. There is a little bit of talk right now as far as moving forward into 1/1/2024. What's the underwriting guidelines going to look like? We don't have those quite yet. So you'll see that second to last bullet point says that new employers requesting entrance will be underwritten. And actually, like I said, if you did not complete the interest survey, those groups would not be allowed in 1/1/2023, would have another opportunity 1/1/2024, and we'll certainly be communicating those underwriting guidelines out just as soon as we have those. And then last but not least, and you can go on there, but last but not least, we do ask on our association health plans that groups that enter into the association health plan, if they decide to leave in the future, there is a period of a lockout period, if you will, because we don't want groups jumping in and out of that association health plan. So just know that once you're in, you can leave at any point in time, but in order to get back in, you may have to be out 2 or 3 years. So this would be the acceptable plan pairings. I kind of discussed this just verbally here a minute ago, but again, we do offer high-low options, triple options, and what's called quad options. The quad options would incorporate what's called a high deductible health plan that would allow your employees to open a health savings account. So that's the beauty of offering a quad option that incorporates that high deductible health plan. So again, this is talking about those groups that were interested here in 2022, interested in joining the Chamber Blue plan for 1/1 of 2023. So probably won't spend much time on here. One of the things you may have heard out from maybe some of your groups or maybe your group, but for those groups that were currently enrolled with Blue Cross, it was a very simple process. We just needed to identify the business, the group information, and the policy number. And really, that's all those groups had to do. A little bit more information needed for those groups that were not currently enrolled with Blue Cross, so that we could, again, do our best to assess the risk of the population we're bringing on so that we can set the rates for 1/1 of 2023 appropriately. This was the timeline that we initially worked from. Again, you'll see that the interest survey was sent out. We communicated that out and have been throughout the summer months, if you will. The deadline was in August 2022. The rates, the rep assignments, the group enrollment, all of those type of things were then done in October 2022. And again, what's not on here is the final rates. Those are projected to be coming out around December 1st. And then at that particular point in time, when we know those groups that will be entering into the association health plan, we will provide the welcome materials and ID cards. So just some contact information here. You'll see my contact information at the bottom. So feel free to either work back through Hannah, or if you want to reach out to me direct, I certainly welcome that. And what I will do is, based on the employer name, I will get your group to the appropriate representative, and they can talk with you more specifically about the Chamber Blue plan and how maybe that impacts your specific group or a group that maybe you're working with. There's also a chamber executive of executive and staff, Ruth Littlefield, and you'll see her contact information there as well. So you can certainly reach out to her. From time to time, we do get leads from Ruth. She sends those through our management staff, and then those get distributed out to the field representatives. So either way, you can reach out to either myself or to Ruth. And we'd be happy to help you. So with that, I've got about maybe 7 or 8 minutes, I think. What questions do you have? Eldana, do you have a question?
Yeah, so if your area's local chamber was not listed on that slide, how would our providers find out if their local chambers are participating members?
Yeah, I'll tell you, that list was provided to us quite some time ago. So if your chamber wasn't on there, don't be completely alarmed. The best thing to do is to reach out to the local chamber and ask if they are participating in the Chamber Blue of Kansas plan. So that's the best thing to do. The chambers across the state that are participating, the chambers should have been communicating out to their members about the Chamber Blue Plan, but we weren't privy to a lot of that communication. So not sure if that was done or how frequently that was done or in what setting that was done. But certainly reach out to your local chamber if you didn't see them on that list.
Any other questions? Okay, Doug, I have one. So,
Okay.
so you mentioned this is an association health plan. So
Yeah.
is there the possibility of early childhood programs forming their own association and being able to create something like this separate from the chamber plan?
Very possibly, Cornelia, and I have to have you provide a little bit more information to me. Now, I probably need to get you to the appropriate person at Blue Cross. The field reps, which is my role at Blue Cross of Kansas, we're not the ones responsible for actually setting up that association health plan. I'm not privy to all of the legalities and things done behind the scenes to actually get the ball rolling and get the plan in motion, if you will. But I'd be more than happy to provide that information on so that somebody could reach out to you and have that conversation with you. Again, I don't know enough about the legalities to know, if you could do such a thing. I would think you probably could. I can tell you that we have, we tried to put together an association health plan a few years ago with the tire dealerships across the state of Kansas. So there was some interest in all of the tire dealerships coming together to put together an association health plan. Obviously, we're doing that with the chamber. So I think there's more leeway as far as putting together association health plans than maybe there was in the past.
Thank you. Emily, I think I saw your hand pop up. Do you still have a question or no?
It's not really. Doug, you kind of answered it for me. It's when Cornelia brought up that concept. I'm vice president of CCPC, which is a 501c6, which kind of goes along that Chamber of Commerce realm. And so that her question was mine, and I wanted to see, but you kind of confirmed that the email I just wrote down is probably the best way to have this conversation offline.
Yeah.
Between you and I, and then kind of figure out all those details.
Yeah. And I would be more than happy to pass that on. And we've had, I just know, because I've heard through the grapevine that we've had a lot of people reach out to Blue Cross about setting up association health plans. Mm-hmm. So there's a lot of banter and a lot of interest in doing that. So certainly get with me, provide your contact information. You can send an email, you can give me a phone call, and I can certainly get you in contact with the appropriate person at Blue Cross to have that conversation.
Awesome, thank you.
That's good. We also have the contact information for Ruth Littlefield, and she, has offered to give, guidance or just insight in terms of the process, in terms of either local mobilization or what they did from a statewide, chamber perspective. And so, the reason these questions are coming is because, in the early childhood realm, it's not uncommon for us to not be able to provide benefits to our employees. And it's in part because of the cost of insurance, right? And so if there was a way for us to band together and be able to create something similar. Not everybody is a member of the chamber, and I didn't see our local chamber on there, but I know that the list is not updated, so I get that. Right. But just something to think about. So thank you very much for coming in and sharing information with us.
Yes, I appreciate it immensely. Like I said, just let me know if you have other questions. Appreciate it.
All right, thank you.
All right, thank you.
Okay, so we have we are having a break, and so we have a 10-minute break, and so it is 9:44. So we will come back at 9:55. So please go on ahead and stretch, grab some coffee, grab some water. When you return, we're going to return in our breakout rooms. And so we're going to have the quality and environment group is actually going to stay here in the main room. And then our family navigation and childcare recruitment and intention groups will use the Zoom link that was shared in the email that Hannah sent out on Tuesday. And so we'll see you in about 10 minutes. So bye, everyone. See you in a little bit.
And for all of our new panel members, if you have not been assigned or joined a work group, just go ahead and pick whatever piques your interest. So use those same links.
Am I supposed to be in my work group now? This is Christy. I'm in for Natalie.
Yep, we just go into the work groups. I think she said she was quality and environments.
Family partnership.
Okay, yep. So she's a different Zoom link. Do you
Okay,
have
I
that?
have it. Yes. Okay.
Sweet.
Thank you.
Mhm.
So quality environments will stay here. And so I guess I'll just kind of rotate between the groups. Sounds good.
Yes, that is great. I'm so sorry, guys. Just give me 1 second here. Cornelia, so we'll do 25 minutes. Is that what you want to do? And then so we'll come back at 10:20.
Okay.
I'm texting Sarah, so.
That's good.
All right. So do we have anybody in this group? I believe I'm facilitating this group. Do we have anybody in this group that that this is your first time in a work group, that you just picked this one? Or are you all okay? Hey, Brenda. I heard that your hey Tara, I heard that your coalition, your KBC conference went great. All right. Yeah, Logan said it was amazing. I had him kind of give us a little blurb at one of our last meetings.
Oh, thanks. Well, we like to think so. So it sure was fun. I know that.
Well, good. I'm glad to hear it. Okay. All right. One last thing in the chat, and then I'm all yours. All right, so it looks like for quality and environments, what we're going to do this week, or I'm sorry, this panel meeting, since we're just bringing these work groups back together, is just kind of go over some of the recommendations that were brought forth by this specific group. And so I believe that this was the recommendation for the LICCs and the state interagency coordinating councils. Is that correct? Okay, wonderful. So I'm just going to kind of give you an overview of some notes that were sent out in April, and this is kind of the culmination of what was done within this work group. So there was a recommendation to broaden the local ICCI participation and membership through strategies, and there's some strategies named there, stipends for time and travel, and then support for childcare for council members. Also some suggestions about research funding opportunities for stipends, for time spent on the local ICCs and state ICCs, as well as promoting communication of LICC members to create awareness of community resources and share them throughout their communities to address the needs of children and families with developmental delays, disabilities, and/or special healthcare needs, sponsor engagement events within the community, and then proposed monies included in the state ICC budget to fund community projects proposed by those LICCs in support of the strategic plan. So that's kind of what this group raised by the end of last year's session. And so the purpose of today's work group is just talk about what went well and maybe what you guys want to work on this session, or if this group needs to disband and you think that there's a different bucket of work group that we should create. So I'll just be taking notes and talk amongst yourselves.
This is Emily Barnes from Olathe. I really enjoyed the work that we did last year, and so I would hope that we see that what we did was valuable, and that going forward, this group does have room to keep the conversation going. One of the things that we had talked about in that recommendation was like budgetary money. And I would be curious to find out, because I know like that whole request thing was like June or whatever of this year. And I don't know that we've ever had a chance to find out like how that went, and so I would say, I would love to hear answers on, what the request was and whether or not we received, whether or not LICCs received that at all, because I know there was a pretty significant request that was going to be put in. Secondly, at the end of last year's work, we had talked about, one of the important parts would be asking the workforce what their opinions are on the topics of this work group, because if it's going to pertain to them, we might want to get their feedback. And so I would again just kind of promote that, that might be a starting point, is to find out what does the workforce feel and want and desire.
So Emily, I heard you say that you want follow-up on the budgetary requests and you want to check in with providers before we move forward. And I'm the newbie on this group, so apologies if this is a really silly question. But when I saw the title for the work group, Quality and Environments, I'm like, oh, we're going to jump into like the links to quality. So is that something another group is doing? I'm just curious.
As far as links to quality?
I know what links to quality, I know what they're doing, but I'm wondering if the recommendations panel is also considering recommendations for links to quality.
No, that's not been within the scope. So
Okay.
Quality and environments, as I understand it, typically has a lot to do with like licensing and like literally quality environments. Yes, but not quality recognition programs like links to quality.
Thank you.
But that could be work of this group if that's what your suggestion is.
Just saw the word quality, so it can mean so many things.
Part of where part of where the focus began was that in year one of the panel, quite often conversations that we would have in our large group would return to, or would circle to, the concept that like families with children with developmental delays or medically fragile healthcare needs would struggle to find care, adequate care. And then as we discussed that, it would also circle around to the fact that the providers responsible to provide that care quite often were understaffed, underinformed, overworked, things like that. And so that, we maybe had a consensus of a workforce who would desire to take care of those children, but were not in the capacity where they could. And so then from there, that kind of developed into this as conversations of how do we, yes, I will set you up with paint in just a minute. Can you let me finish this one thing for like 2 minutes? Thank you. And so we had started conversation kind of from there, and it's not specifically about dictating what quality is in an environment, but opening up conversation of, hey, this is a topic that keeps coming up about environments, and what conversation can we have? And as a member of the workforce, I'm always going to come back to, like, if we're going to talk about the environment, then we need to get the feedback from the people who, in fact, are implementing those environments. And that's why it's important to me to make sure that feedback is one of those topics.
Thank you, Emily, for the history of how we got to today, and the history in that. I appreciate that as the new person.
So historically, I might be able to help a little bit. So you all know that we are building a career pathway, and we are slowly entering into phase 1 of implementation. So it should be around first of the year that we're releasing that to the workforce. And then we're also working on the development and implementation of a workforce registry. So the links to quality thing is very relevant because soon, like within the next year, they're going to have to scale what has been a pilot program for a few years and do a statewide rollout. So if this group has specific interest in You know, I mean, because links quality is our quality measure for the state of Kansas. And, you know, it would be an opportune time if we wanted to take that on during this session. But Emily, back to your comment. So specifically, if we were to get some provider feedback, and that could be from, you know, maybe CCPC, maybe that's something that we task you with. What would the focus of the feedback be? What are we wanting to find out? Would we want to bring a few options to them and say, where should the focus of this group be? Or how do you all feel about that?
I'm open to ideas, but from this group, and maybe I'm the only one who wants this, but I'm open to what people are thinking.
So this is Maritas Altuna. I do have a question, a follow-up to, may not be a follow-up to Emily's question, but so when we submitted the recommendation, I'm not quite sure if we have heard the responses of those recommendations that we have sent. Where did we send the recommendation? Did we send it to the Children's Cabinet? And then did we heard back from any of those recommendations, feedback from the Children's Cabinet?
I am not going to be helpful here. I apologize. I would be very willing though to ask this in the greater room, because I know that we'll have people that were following this endeavor, and so they should be able to report back on what the results of those recommendations were. And specifically, Emily, when we're talking about the funding request, we're talking about, you'd like the result of monies to be included in the state ICC budget to fund community projects proposed by the LICCs. Is that correct? I think that's correct.
Yes, sorry, had to come off mute. I've got friends very excited about paint and paper and water and so yes, yes, wanting to know what happened with, yes, paper's right here. Okay, friends, give me like 3 seconds. Here's the paper right here. I'll go get the water. And what happened with the budgetary request? I do agree with Marisa. I would love to see, you know, like if the money, you know, if the funding was granted, what was done with it? How has it been implemented? You know, do we have anybody doing this, or is this just kind of sitting out there waiting? Hey, Frank, the water is right here. I'm getting it. I promise you get to paint. And so, yeah, I think it's this stage. I'm also very much interested in the follow-up on what's going on, things like that.
So go ahead, Dave.
I just gonna say, let me clarify for this group that the state council did set in place a mechanism for local councils to apply for some funds to support activities at the local level. It will be a pretty simple process, you know, a short application explaining what they intend to use the funds for. So the council has approved that. Additionally, the current dollars that were available were some leftover dollars because of lack of travel of council members related to the COVID year. So there were some travel dollars that built up in the budget. So those dollars are going to be used for the local councils. That's where the initial dollars are going to come from. Then it was time for the interagency agreement of supporting the council was up for renewal, 5-year renewal. So the council anticipated that based on the amount of dollars that were sitting there, we would have enough resources, hopefully, to support the applications of local councils. Then in years 3, 4, and 5, the agencies were asked to up their commitment to the council for those years, that would then, those additional dollars would then be used to support the local council. So that's what has happened as a result of the recommendation. So hopefully that helps.
Thank you, Dave.
Another thing that's bubbling that could be relevant for this group are the proposed, so we're ending the end of the public comments period for this specific thing, but there may be some implementation that this group could help with the proposed regulation changes to child ratios. So that's ending on the 28th. They're taking public comment for that until the 28th of this month. And then I would assume from there that, if it goes through, then there may be some conversations about that. So that's another thing. Emily, would you be willing to raise this to CCPC and kind of describe the purpose of this work group and ask what they'd be interested in?
Absolutely. Yeah.
Okay. And is that something that we could maybe ask you for a report back by next panel?
Yeah. What, just for clarity, what is the specific request that this work group is wanting from CCPC? Just their willingness to collaborate, or what do members of this work group want me to ask? Because frankly, I already know that CCPC is going to be interested in collaborating with entities that are making strides in the state. So I already know that part. The key is, like, is there something that we want CCPC to actively work on, like town hall meetings, newsletter article type, like what, and I'm trying to make sure that I come back with information more than just like, hey, yes, CCPC is willing to collaborate, because I already know the tempo on the board of that answer.
So I might be speaking out of turn, and please, group members, if I'm encroaching, let me know. I think probably we would want to know, are there specific concerns at especially the family childcare level for, childcare for CCPC specifically, either maybe the regulation type things or specific things that are happening within the system that they would like the authority and the subject matter expertise and kind of the representation from this group to help influence. And so I think that's anything that's, making their childcare environment difficult, or if there's barriers that specifically relate to quality and environment. I think that's what we're looking for.
So I think, Hannah, what I heard you say, this is Brenda again, is that we're looking for some feedback on direction for this work group. What is like the next thing that we might be able to address?
Amy, I'm gonna give you a quick catch up. So we just kind of went through what this group, what quality environments did last session, the recommendations about the LICCs. Dave provided us with an update about how that funding recommendations actually being enacted at the local level. And then Emily has recommended that we get some feedback from providers. She's offered to get some feedback from CCPC by next panel meeting about specific quality and environment factors that maybe we can influence for the field. I would ask the same thing maybe of your staff, if there's things that you're hearing about.
I'm probably in the wrong group then. Are we in breakout groups then? Because I just got here.
Yeah, and I can't tell who belongs in this group because this is my first session. Hey, Amy, what's
Okay.
up?
Okay. All right. I'd have to go back to the email and find the link for my right group because I'm not in quality improvement. Sorry.
That's fine.
Okay. All right. I'll
You're
figure it
totally
out.
fine to be here. We're fond of you.
If I can't find it, then I'll come back. Thanks.
So one thing I wanted to put on the radar for this group is I belong to another group, and it's the Women's Economic Development Task Force for the state. And they just completed this summer a series of town hall meetings to hear from women about economic issues. And of course, childcare was at the top of the list. No surprise there. But on November 15th, they're going to be releasing their report of their findings from these town hall meetings. And so I want to bring that to your attention so you can be looking for that. And perhaps I can get the link to that press conference out to Hannah to include in the notes, because it will have significant information about what they heard in the town hall meetings. And also they're going to have some recommendations. And this is a group of business leaders from around the state who aren't as deeply embedded in childcare as you all are. And so I feel a bit like an ambassador between these two worlds. So I'd like to keep you informed, because I did hear some discussion in our task force about doing a national survey of licensure for childcare providers and to see how Kansas compares to the rest. So that sounds huge. It sounds like a huge undertaking. But so before they go off in that direction, I just wanted to let you all know that we might try to inform that work if they're going to tackle something related to childcare.
And you said that was released on 11/15. It will be released. The report.
Correct. Yeah,
We may
9
be able to
a.m.
actually. I think we'll meet again on the 18th. So if you guys want me to keep an eye out for that and bring it back to this group, we could do that and talk about it. And Brenda, that was the Women's Economic
Development Task Force. And I cannot talk and click and go out and find all those things and drop it in the chat, but I don't think we're supposed to anyway. So I will do that after the meeting. I will send, is that okay? Is that how we share resources, is after the meeting in the notes, right? Okay, so I will get to you, Hannah, the link to that press conference when they're releasing the findings from the town hall meetings. And like I said, childcare was at the top of the list. So whatever, you would just be interested, I'm sure, in the findings and then the recommendations about what they're going to do with that afterwards.
Yes, I think that sounds good.
This is being led by United We, if anybody is familiar with them, Wendy Doyle's group. Yeah.
Okay. Yep. We get updates from them. So we do owe our friends on the panel a report out. Anybody want to do that? Brenda just shakes her head.
I don't mind being the one to do it.
Okay. Do you have what you need? Okay. We can do that. And what I'll do is just prepare information about anything having to do with that regulation change, because we'll know a little bit more. It'll be 3-4 weeks out at that point. And then try and look for that report from the Women's Economic Development Task Force. And then see if I can track down maybe something in writing about the funding. And so we can just kind of pick up where we left off next time. Thank you guys for your patience with me.
Thank you for the nice summary, Hannah. Appreciate it. And thanks, Emily, for volunteering.
It's so much for my own benefit, so I don't forget.
We're going to allow just a few minutes for everybody to come back to this meeting so that, Emily, as you're getting your spiel together on what you'll say for the work group and during this time. And so thank you guys. We haven't had anybody come back yet. So I think they're in the midst of their conversation. So hold on tight, please.
Emily, I'll say that your speaking to children through your teeth voice is a lot nicer than mine. My poor kids, they don't get that. You're very good at that. The amount of meetings I've seen you on, being able to control the chaos and still participate is really commendable.
Some days it's like, it will be completely calm and perfectly quiet and each kid engaged in something. And so I'll be like, yeah, I can say something. And the moment I do, whoa, the room just explodes. Oh, hey, friend, you're taking that paper. She would like the paper back. You can use yours. Like that. Exactly like that. We were quiet until I started talking. You're all done? Would you like to hang it up?
Okay, I think we have a good number of people back, and so let's go on ahead, and I'm looking forward to hearing the updates and whatnot from the different work groups. And so why don't we go on ahead and start? Do we have a representative from Family Navigation on who would like to give an update on your work group?
That would be me. Good morning, I'm Megan Kluth with CPPR out of KU, and I am the facilitator for this group. So we had an interesting conversation. We kind of did some level setting and walked through what the group had talked about previously. We've talked about kind of family engagement and partnership in the past, as well as navigation and families' experience within the early childhood system. So we kind of spent the first few minutes doing a reminder of some of the things we've talked about, and then picked up from a conversation that we had in the spring using a Jamboard of different ideas, and just did a refresher and really landed on a conversation about a couple things in particular. One being wanting to know more about the Family Resource Center work that DCF is leading, and just thinking about how can this group and the panel in general make sure we know what's going on with that and help support or inform that wherever there might be spaces for that. So I think that was a great conversation. And then we talked quite a bit about just language and where this group might be able to help inform that. Somebody shared that one of the other family councils had a good conversation at their last meeting about how words like referrals might be a bit off-putting to families, or that word might have a different connotation to families than we think of as we use it every day. Or even like, we're going to come into your home and evaluate, like that might just have a different feeling than is intended. And so how can we look at language, and also how can we help people who are making referrals, like make sure that they are sharing about eligibility in that. I think sometimes there can be this sense of, oh, I don't qualify for that. That's for people that have higher levels of need than me, and that like family situations change, and that a lot of the services and programs that we talk about within early childhood are really pretty open to a lot of different family situations. And so how can we kind of help both people in the system and families? How can we look at language to help increase that understanding so that people are really aware of all the different resources that may be available, and they can make good choices for their families. So that's where we left off, but I think we've got a lot of room for good conversation moving forward. I don't know if anybody else, if I missed anything, if anybody else wants to jump in. All right, thank you.
Thank you, Megan. And do we have a representative from the Child Care Recruitment and Retention Group?
We do. That would be me. I'm Sarah Gardner. I'm also with KU CPPR, and I'm the facilitator, or was the facilitator today for this group. We started off by reminding everyone in the group of the wonderful recommendation that came out of the spring work to issue one-time bonus payments to childcare professionals, which is being activated on as we speak. There are over 20,000 eligible childcare professionals who are in the process of hopefully receiving these payments that range from $750 to $2,500. So real dollars in the pockets of those folks who do the hard work of caring for our kids in Kansas every day. So we celebrated that, acknowledging that was not the be all end all for the work, that's just a stopgap. And there's a lot more work to be done around wages. We talked about what might be next and what might be the focus of the group. Ran through, first we talked a little bit about the bubbles that we're hearing about Spanish speaking providers or providers who are where English is not their first language, and how we should maybe celebrate that and come together a little bit on strategies to help recruit and support those professionals for whom English is not their first language, and they're going to be doing really good work serving children who English is not their first language. We talked about all of the different efforts that are happening in the state around childcare recruitment and retention. Kind of had a laundry list of activities ranging from stuff that state agencies are doing to stuff that local communities are doing. Childcare Aware is leading a lot of community level efforts. What are different initiatives around career pathway, workforce registry, different marketing campaigns. So what we kind of landed on was, I feel like before we can make a kind of put our feet down on what's next about what this group can do, it's really gathering all that information and making sure that maybe this group focuses on some strategies to ensure alignment of all of that work. And then how can we, as the panel working group, plug in new initiatives or new efforts, or just ensure there's good alignment across the board. So kind of learning about all what's going on and being informed, and then creating strategies around alignment for that. Final thing we talked about is kind of looking at the broader community context of where childcare sits. So what are the needs of families as they evolve in a community? One, for 5 or 6 years, you may have a lot of littles, and then those littles get older and there aren't, more infants to backfill those slots. How do you as a childcare, or how do we support childcare providers in navigating that flow, particularly in smaller rural areas where there is a difference in population that comes in waves, and how do we prepare professionals to navigate that, the business side of that as well. So talked a lot about community context and how to bring that and inform that for our childcare providers. I will invite any others from our group to share anything I might have missed or clarify. Okay, thanks, Cornelia.
All right, thank you, Sarah. And last we have Ms. Emily, I believe, is going to be the spokesperson for the Quality and Environments Group.
Yes, thank you. So in Quality Environment, we talked about kind of wanting a little bit of an update on, part of our recommendation last year had been about ensuring that the ICC oversight had, budgetary requests, and making sure that there were resources made available and to families, providers, communities, things like that. So it was kind of follow up on what went on with those budgetary requests, what is happening as a follow up as far as, what action is being taken as a response to the recommendation. And we did learn that the review happened, the 5-year review happened in June, and that there were some extra travel dollars. The benefit of the pandemic years is that there were some travel dollars that were able to be allocated in that manner, and so that has been helpful. We were also able to learn that there was some work done on making sure that from the local ICC group, they were able to make some requests for funding to implement the work. And Dave, you were the one who gave the details, so if I got any of that incorrect, please correct me. From there, the discussion kind of focused on if we're gonna have topics that pertain to, quality and environment, we might want to get some feedback from the people implementing those environments. So from there, we kind of discussed that I will go back to CCPC, Child Care Provider Coalition of Kansas, to start to get some thoughts on, what does the workforce want as a focus? Does it pertain to, work done with child care registry, workforce registry, or the career pathways and workforce registry kind of work? Did you have thoughts too? You have thoughts too, yes, thank you. And so kind of get some feedback on how we tap into the voice of the people doing the work, and what they would like to see the focus be on going forward, and so that we can make some, or have some wise conversation and come up with some topics that will benefit everyone in the environment, the providers and the children and the families. I think that's it. If anybody else has anything to add, please jump in, because it's quite likely that I forgot a detail.
I will just add the other thing, Emily, you are just a saint, by the way. You just have 7 hands there. The other thing Brenda Bandy reminded us of is that there is a report that's being compiled, and we should have that report November 15th. And it's being compiled by the Women's Economic Development Task Force, since that's comprised of business women. And one of the things that they're talking about is childcare, because we know that really disproportionately affects women. So they're going to be coming up with a report and then presenting their findings on the 15th of November, like I said. And so we're going to bring that back. I'll chase that down and bring it back to the Quality and Environments Work Group and talk about if maybe there are some implications from that report that this work group should inform and their next steps. I think that was it.
Well, thank you all for the updates on your work groups. It's great to, I think it was probably good to connect again, right? And to be able to celebrate all of the wins and the things that we've done and accomplished in our work groups. As I said, I've said more than once in having conversations with people locally, about this group, is that I love that it's not a group where we just have meetings and we talk, and then we just talk about the same stuff, but we actually work to make action, put some action and, put some feet to the ground and make things happen. And so I love that. And I love being able to kind of pop into groups and hear, the excitement about the work that we're doing and the changes that are happening because of our efforts. And so that's very cool. So great job, everyone. So we have a couple of updates. First being that the state that, as you all know, childcare licensing is, they're proposing an amendment to regulations, and they're giving people opportunity to provide written comments through October 28th at 5 p.m. So if you have not done so, please go to the website listed here. You can also go to KDHE, and there'll be some guidance there, but you can click the link here and provide comments. There are also, if you want to provide comments when they actually have their hearing, you have to bring 1 copy of your written statement if you would like to actually provide comments at the hearing. There is also a webinar scheduled for licensed home providers, and that's going to be on Monday, October 24th from 6 to 7. This webinar is not eligible for in-service hours. And so, but there is going to be a webinar on October 24th from 6 to 7. The next is about the child tax credit. And so we have 4 weeks left for families to claim at least $3,000 a child for towards their tax credit. This is for low and no income households. And so the low and no income households may be eligible even if they've never filed before. It has to be filed by November 15th. So if you have families that you serve or have a way within your networks to be able to spread the word about the tax credit, we want people to know that this money is available to them. And so ways to get the word out, send text messages to your parents and your families, post it on your social media page, send it an email out to your parents and families. And then there's the website, they're listed as well. But, please get the word out because, again, they have until November 15th in order to claim the tax credit. Last update is that we want to hear from home visitors and home visiting program administrators. We need your support in terms of expanding home visitation programs. So here is a QR code for a 30-minute survey. The information is going to be used to describe the readiness and the needs of program expansion. We know that especially over the past 2.5 years, our families need support, right? I mean, there's a lot of help that's needed. And so there was the need prior to, the past 2.5 years, and it's only expanded and gotten, and the need is even greater. And so information is going to be used, as I said, to describe the readiness and the needs. Home visitors will be entering to win one of 250 $100 Visa gift cards. That's amazing. If you're a home visitor or a home visiting program administrator, please use the QR code below, and please complete that survey. Please share the link with home visitors and local home visiting programs within your area. The deadline to complete the survey is Friday, October 28th. And so we still have about a week left. And so please go ahead and share this information with your colleagues. Bright spots. Do we have any bright spots? Does anybody have anything that they would like to share in terms of their program, their communities, or anything going on? All right, Alana.
It's very, very, very exciting news for Johnson County Home and Center, Johnson County child care providers. Yesterday at our Board of County Commissioners meeting, they did approve a request. I had requested to be able to cover the fees for the county fees for our child care providers, kind of the same thing that KDHE has been doing for providers across the state, not just homes. And that was approved. So all of my Johnson County providers will have their county fees covered for 1 year. That was super exciting. Even more so, our Board of County Commissioners also put a lot of money into our, I gotta get the acronym right here, Enterprise Center in Johnson County, which will kind of do two things. One, it's for any small business that kind of needs that additional financial assistance along the way, and childcare is included in that. And second of all, in my group, I talked a little bit about classes that would be beneficial to providers that aren't necessarily childcare related, but their business, et cetera, and how to run a business and how to do all those pieces. And it sounds like part of this funding that our Board of County Commissioners approved yesterday will be able to help create those kind of classes for childcare and providers and help to recruit new providers in Johnson County. I'm really appreciative of our board.
That is awesome. Emily, you are next.
So to piggyback on to what, would you like me to read that book? Can I have 2 minutes and then I will read that book to you? That's not so on that note from Aldana, while that was happening, early in the week, Commissioner Becky Fast out of Prairie Village had talked with Channel 9 News, and they were able to get in touch with a couple of us providers. And so as a result, we were able to participate, another provider in Johnson County and I were able to participate in a news report that highlighted, instead of only focusing on the negative of what comes out of childcare. They were able to, focus, the bright spots of our work, and, yes, our needs, we talked about our needs and, things like that. So yeah, that was kind of a neat thing that as Johnson County county commissioners were doing their work, our work was being highlighted as well. So I was very appreciative of that.
Very cool. That's awesome. Thanks, Emily. Jennifer.
Hi, Jennifer Adema with the Kansas Head Start Association. There's been so much going on this month, so many really positive things. I really had an opportunity to connect with some of you on this call and go out and be at some conferences, hear from our Head Start programs, which was an amazing opportunity. We also found out that we were awarded one of the Kansas Leadership Center Leadership Transformation Grants, and alongside some of you on this call as well. And I really look forward to adding that framework to Head Start programs across the state. And then I think, though, my best highlight was yesterday when I was doing the really exciting executive director work of digging through the safe deposit box in the bank, the basement of the bank. The young man that was helping me was asking me, what do you do? Who do you work for? And I said, oh, Kansas Head Start Association. And he said, I know all about Head Start. I was a Head Start kid. My mom was a young mom at 19. And all I remember was going to school, having so much fun, and getting tons and tons of books. And I said, that is amazing. And we had the best conversation. And I think a lot of times we don't get to hear those stories come back about the impact that our work makes on the lives of kids and families. So that was the highlight of my whole week yesterday in the basement of the bank.
As it should be, right? And so, you're doing good stuff, and that makes you keep on keeping on, right? And so that is awesome. And so, Brenda.
Thank you. I don't know if mine's going to be as moving as yours, Jennifer, but I do want to celebrate that we had the Kansas Breastfeeding Coalition annual conference last Friday, and many of you were in the room. Logan, Jennifer, Childcare Aware was well represented with Chris Nicholson, and we got to celebrate the breastfeeding friendly childcare providers that have been designated over the last 2 years since we met. We had more childcare providers than ever in the room. So that is exciting that they see themselves literally at the table when it comes to talking about breastfeeding. So I just wanted to say kudos to everybody who was there. I think we had a really good time. And we also are a recipient of the transformation grant from the Kansas Leadership Center. So we look forward to being there alongside Jennifer and her crew. So I'll turn it over to Logan.
Hey y'all, I wasn't sure because I was trying to had some Zoom issues. Did anyone talk about the Rural Champion grant that got announced? No? Okay, well I got excited because there were 12 rural champions selected across the state, and 4 of them are working on childcare. So they're out of all the varying topics, childcare seems like it came up the most and is the most prevalent project. So I thought that was really exciting. Just to know that there's more leaders and that the state sees the priority and that we'll have some folks that are boots on the ground leaders in those communities. So it'll be really exciting to connect more with those folks and learn from them as they're navigating this next year of that grant. And then I also wanted to highlight from the Kansas Breastfeeding Coalition, for our past board chair, Stefana Rubnicki, she was recently elected to the U.S. board for the Breastfeeding Coalition for the entire country. So we have some Kansas representation on that level, and I thought that was really amazing because she's an incredible leader here, and just thought that was really, really neat to piggyback off Brenda.
That is awesome. Very exciting. Absolutely. All right, Pam.
Just a reminder that the Parent Leadership Conference registration is open, and we are so excited to have the Parent Leadership Conference in person. It's been a while, 2019. So it is November 4th and 5th at the Hotel Topeka at City Center, which used to be the Capitol Plaza, and I'm struggling to adjust to the name. So November 4th and 5th, the registration is open online. We do offer, we have 100 hotel rooms that we offer for families who live more than 50 miles one way from Topeka. We offer a child care. There will be a touch-a truck Friday afternoon. The fire department is coming unless they have to go to a fire. We're really excited. And the Kansas Discovery Center Mobile Museum will come Friday morning for our childcare. And we're also having a youth track this year. We always have some youth that come with their parents. They're too old for childcare. They're too young for parent sessions. So this year we will have a formal youth track as well. If you have questions or need additional information, you can email me at pnoble@kcsl.org. And we're just really excited. And if you're in Topeka, feel free just to stop by and visit with us. Thank you.
Thank you, Pam. So for upcoming meetings, we would like to let you know that our next Children's Cabinet and Trust Fund meeting is Friday, December 2nd from 9 to 12. Our next early childhood group meeting is also Friday, December 2nd, following the Children's Cabinet meeting. And then the early child recommendations panel is going to be on Friday, November 18th from 9 to 11:30. So until then, I hope that you all have a wonderful, wonderful rest of your day, a wonderful weekend, and looking forward to great success and more updates when we meet again in November. So thank you all again for your commitment to the children and families in Kansas, and for helping support the state and the efforts of everything that we're doing in Kansas to be able to help improve the lives of those who live in our community. So you guys have a wonderful day, and we'll see you soon. Bye.